Hi, I'm Dr. Madhavi, a senior pediatrician based in Hyderabad, and this is Qavach. The best pediatric care happens when parents, toddlers, and pediatricians function as three key stakeholders working towards one shared goal, that is, a healthy child. Last week, we looked at things from your child's point of view. Your toddler needs you to be present and to intuitively understand what's happening with their little bodies and big emotions. Today, I want to shift the lens because it's equally important for parents to understand how pediatricians think and how you can support us in making the best decisions for your child. Today, I'm going to share two important secrets about pediatricians. So please listen carefully. The first secret is this: how we pediatricians organize and process information about your child. Most of the time, we organize what parents tell us into three simple buckets, that is function, trajectory, and impact. Let me explain. The first bucket is function. We ask ourselves, is the child eating, sleeping, playing, and interacting in a way that supports daily life? If the answer is yes, we are usually reassured. Pediatricians are not overly worried about temporary setbacks. Poor sleep, picky eating, clinginess, mood changes, these happen. What we watch for is recovery. When the trigger passes, like illness, travel, routine disruption, does the child gradually find their way back to baseline? Recovery does not mean everything looks perfect. It means things move backward, normal, without force. If regulation returns, that tells us that the system is intact. In fact, most everyday concerns parents bring fall into the first bucket and resolve on their own. The second bucket is trajectory. Toddlers cannot be assessed in single moments. They vary from day to day in appetite, sleep, energy, and mood. There will be good days, off days, and everything in between. So the key question we ask is, overall, is this child moving forward, even with normal ups and downs? That's why pediatricians look for patterns, not snapshots. Patterns help us tell the difference between normal development and suggest that truly needs attention. The third bucket is impact. Here we ask, are any of these concerns starting to interfere with daily life? Is sleep affected? Feeding? How about play, learning, or engagement? When concerns persist and begin to interfere with daily functioning, they move into this third bucket and deserve a closer discussion. Now, why am I telling you all this? Because when parents understand how pediatricians process information, it becomes easier to understand moments when your doctor says, this looks normal, there's nothing to worry about, even when you are feeling concerned. Now let's do a reality check. Parents notice things doctors simply don't have the opportunity to see. Parents notice sleep rhythms across weeks, feeding patterns across routines, play becoming more imaginative, language growing in real life situations, emotional responses to change. These everyday observations are incredibly valuable to us. They help pediatricians understand the bigger picture, whether something is settling, evolving, or needs closer attention. The reality is, pediatricians often get just 10 minutes with your child, isn't it? In that time, we need to examine your child, listen to your concern, review family history and risk factors also, assess trajectory, assess impact, and make decisions. Doing all of this well is extremely hard without your support. So now I'm going to share the second secret, how you can present concerns in a way that truly helps your pediatrician. Here are 3 simple things that make a real difference. First, notice change without comparison. Comparison is one of the biggest sources of parental anxiety, isn't it? Someone else's child talks earlier, another eats more, another sleeps better. But pediatricians do not compare children to other children. We compare your child to themselves, probably from the time of the previous visit. What helps us most is knowing, has something changed for your child? Second, anchor observations to time. Words like sometimes or recently are hard to interpret clinically. What helps far more is time context. You don't need exact dates, just direction. When did this start? Days, weeks, or months ago? Is it improving, stable, or worsening? Did it follow illness, travel, or a routine change? Here are some examples. This started after a viral fever and is slowly settling. It's been about 3 weeks and hasn't improved. Sleep was disrupted after travel but is mostly back to normal now. This helps us decide whether something needs reassurance, watching, or evaluation. Third, watch function, not isolated behaviors. Pediatricians worry less about what happens once, and they worry more about whether daily life is affected. We quietly ask, is sleep difficult most of the nights? Is feeding a daily struggle? Is playing or curiosity reducing? Is the child harder to engage than before? If a behavior comes and goes without affecting daily life, it's often part of normal development. When sleep, feeding, play, or learning are affected, that's when it deserves attention. When parents share changes, timelines, and impact, they give pediatricians exactly what we need. This does not mean watching your child anxiously every day. You don't have to do that. It means noticing patterns calmly and sharing them clearly. That's how good decisions are made, without panic and also without delay. Many parents worry they'll either miss something or worry too much about normal variation. Understanding how pediatricians think reduces both of these. You stop reacting to every off day and you don't delay when something truly needs attention. That balance is where confident parenting lives. Over this week, we'll keep building on this, okay? What's normal in toddler health, what's worth watching, and how to think about it calmly. When parents understand how pediatricians think, health decisions become calmer, earlier, and more effective. This is Qavach.